Salam salam, dear Nachu, salam no. Today we will discuss about nursing process. Nursing process. This is our learning objective. The first learning objective is defining nursing process, and the second one is list its characteristics, and the third one is developing nursing care plan based on nursing process in Milan. As you know, when you see the definition of nursing process is a common language of nurses, or it is a tool used as a communication means of language among nurses. In other words, nursing process is a process used to identify the problem of the clients and manage the problem of its clients. It is an organized, systematic method of giving call-oriented care and humanistic care that is both effective and efficient to manage identified problem. So, therefore, nursing process is a humanistic care. That means it is a holistic care and interactive approach to manage the identified problem. Humanistic care means that it focuses on both human response as well as disease response. When we say that human response means that it focuses on holistic approach of spiritual aspect of the patient, economical aspect of the patient, family aspect of the patient, social aspect of the patient. እንግዲህ እነዚህን ያህል ማለት ነው። ሆሊስቲክ አፕሮች ስንል እንግዲህ በሽተኞቹ ከኢኮኖሚ አንጻር ሊሆን ይችላል፣ ከሶሻል ኢንተራክሽን አንጻር ሊሆን ይችላል፣ ከፋሚሊ ስታተስ አንጻር ሊሆን ይችላል፣ and the immunity status of the patient ሊሆን ይችላል ማለት ነው። So nursing process focused on holistic approach. That means it focuses on human response of the patient. And when you see the purpose of nursing process, it provides scientific-based nursing care, holistic care, and individualized patient care. Individualized, not group-based. ይሄ ማለት ነው ለምሳሌ አንድ ሰው ማላሪያ ቢያዝ ማላሪያ ላይ ያሉ ክሊኒካል ማኒፌስቴሽኖች አሉ። እነዛን ልክ እንደ ሰውየው ዲፔንድ አድርገን ማኔጅ እናደርጋለን ማለት ነው። work collaboratively with patients and other healthcare workers to receive quality care with maximum efficiency of the care ማለት ነው and achieve continuity of care and encourage the healthcare teams to observe and interact with patients ማለት ነው። continuity of care ነው ማለት ነው። ስለዚህ ለምሳሌ አንድ ጊዜ አያችሁት example administrative injection and then follow up the drug and body interaction ማለት ነው። dressing change and observe the patient after dressing the dressing change and so when you conclude that nursing process means that provides a roadmap that ensures good nursing care and improve patients' outcome ማለት ነው። Therefore, it is a process that provides a roadmap that ensures good nursing care and improve patients' outcome. Here, it is an acceptable standard for clinical practice established by American Nurse Association. It is acceptable throughout the world. It is a standard that are applied any setup with any age category ማለት ነው። It is applicable for clinical practice established by the American Nurse Association, and it is applied anywhere, any health setup with any age category. And it is a cornerstone of the nursing process. It is a baseline to do nursing care. And it is an opportunity for nurses to build a scientific body of knowledge. Build the market. It creates an opportunity for nurses because we always done assessment, diagnosis, plan, implementation, and evaluation. Always we have advanced our knowledge. It helps us to create our knowledge advance, or it helps us to advance our knowledge. That means it creates an expert nurse. It helps us to create an expert nurse, elevating nursing profession from a vocation into a profession. It advances the knowledge of the nurse and it creates expert in that profession. Where this is the characteristic of nursing process, it is problem oriented. Because we should identify the problem first. Then after that, we should manage that identified problem. So it is problem-oriented process, goal-oriented process. We know at the end what we achieve. So therefore, it is goal-oriented. It is orderly, planned, and systematic. It is circular. It starts from assessment, and we formulate the nursing diagnosis, then we formulate the nursing plan, then we formulate the nursing intervention, then we assess the evaluation again. And it also opens to accept new information during its application. It is flexible, not fixed. It is flexible. It creates to gain new information during its process, and it is interpersonal patient-nurse interaction. There is patient autonomy to express his feeling, and there is also nurse autonomy to accept the patient's idea, and permits creativity among nurses and clients. Creativity. It helps to gain new knowledge, and it creates good interactive or good approaches nurse with clients, and it is universal. Nursing process is universal. Here you can see it. Universal means it is accepted throughout the world. It is internationally applicable with well patient, well person or ill person, children or old age, in any setting. Means that any health setup, it can be applicable. We can apply anywhere with any setup, with well person or ill patient, children or young people or older people, can be managed with nursing process. Where here you can read it. Here is on this part there is patients, benefits of nursing process for patients, and on this side there is benefits of nursing process for nurses. You can read it. Where you see the comparison between medical process and nursing process. Medical process deals most with problem. It focuses on problem response. That nursing process deals with human response as well as problem response. And here, goals are not clearly recorded during planning, but here there is a strict rule. In nursing process, there is a strict rule, and there is 5 steps to manage that problem. That is assessment, diagnosis, planning, implementation, and evaluation is present here. And focus on teaching about how disease and trauma treated, but it considers the whole person's and system function and responses. It considers the response of the person as well as the function of the systems. And here, mostly involved with individuals and religious groups. It focuses on teaching individuals as well as groups. Here is the component of nursing process. The first component is, as we know, 5-step assessment. Here, assessment means that collecting the pertinent information and organizing that pertinent information. Diagnosis, the second step is diagnosis. Diagnosis means that identifying the patient's problem, analyzing data, identifying nursing diagnosis, and collaborative problems. Problem identify and then what happen next, identify and then planning focus on ABC method, prioritizing problems, identify measurable outcomes or goals, select leaders intervention, and document the plan of the care. Plan 1, plan 2, plan 3, plan 4, prioritize 1, prioritize 2, prioritize 3, ABC method, airway, breathing, circulation. በመጠቀም ምን እናደርጋለን? ፕላን እናደርጋለን። ያን ፕላን ያደረግነው ምን እናደርጋለን? ዶክመንት እናደርጋለን። then implementation, carry out the nursing care, the nursing orders. Second one, document the nursing care and client's response ማለት ነው። The second one is evaluation, monitor clients' outcomes, resolve and continue and revise the current plan for care. Therefore, components of nursing assessment and components of nursing process, assessment, diagnosis, planning, implementation, evaluation are the main components of nursing process. And the nursing process is a circular process. Here you can see on the graph, it's a circular process. Here assessment, nursing assessment means a systematic collection of both subjective and objective data to formulate that helps to formulate the clinical judgment, or in other words, it helps to formulate the nursing diagnosis. And here nursing assessment should be accessible for any healthcare with any healthcare teams, should be accessible and help us to avoid the duplication of medical assessment. And when you see medical assessment, it focuses on pathological conditions, and nursing assessment focuses on patient's response. And the data could be objective data and subjective data. Where you see objective data, it is concrete, observable information, or objective data means it is measurable data, tangible data. We call that objective data, like including vital sign, temperature, weight, skin color, blood cell count, vomiting, bleeding, laboratory studies, and physical appearance. Change in physical appearance should be objective data. Objective data means it is measurable. Subjective data, what the patient or client actually states or feels. It means subjective data it is symptoms of the patient. Objective data it is sign of the patient. So nausea, pain, depression, fatigueness, anxiety, illness, we call that subjective data. Purpose of assessment, why we do nursing assessment? To establish baseline information on the client. The first one is. The second is to determine the client's normal functions or abnormal function or risk for dysfunction or strength of the patient. The third one is to provide data for nursing diagnosis. it helps to formulate the nursing diagnosis. Here you can, this one is objective data, and the first one is, the first circular one is subjective data. You can read and do this practical. Source of data, there is two sources of data, primary and secondary data. Primary data is most reliable, that gain from the direct patient interviewing, and it is most reliable. Secondary data, it can be from family, from significant others like prisons, friends, and other health profession, health records, medical records, assessment skills, it is observation, interviewing, physical examination, intuition. Can read it. It's simple. For techniques, inspection, palpation, percussion, and auscultation, we can it. And nursing diagnosis, it is the second step of nursing process. Nursing diagnosis means that identifying the problem with the patient, in short. Nursing diagnosis means that identifying the nursing, the problem of the patient, and when you see the comparison of nursing diagnosis and physical diagnosis, it's focused on disease, but here is focused on holistic approach of the patient. Here is Atodenic has pain and swelling in all joints, all in joints. There is disease focused here. Here in nursing process, where nursing diagnosis now here, Atodenic has pain and swelling in all joints, making it difficult to feed and dressing himself. Psychologically ምን ሊመጣበት ይችላል? ኢኮኖሚካሊ ምን ሊመጣ ይችላል? ሌላ ምን አይነት ሰፖርት ያስፈልጋል? የሚለው ሁሉ አያችሁ ዲዚዝ ሪስፖንስ ፕላስ ፔሸንት ሪስፖንስ ያያል ማለት ነው። ዲያግኖስቲክ ስታዲው ኒውት ሜዲካል ዲያግኖሲስ ስታውት ምንድን ሮማቶይድ አርትራይቲስ ይላል። ነርሲንግ diagnosis he has voiced that it is difficult to feed worthwhile when he can't even feed himself. ሌላም ደግሞ ድሬሲንግ ፕሮብሌም እናውጣለን ማለት ነው። nursing diagnosis አያችሁ it focused nursing diagnosis focused on patient responses. There are 5 groups of nursing diagnosis. The first one is actual nursing diagnosis. Actual nursing diagnosis means that a problem that currently exists, the patient comes to us or chief complaint ማለት ነው። actual nursing diagnosis ማለት ነው። risk diagnosis ወይ ደግሞ potential diagnosis ነው a problem that the client uniquely at risk for developing በአክቹዋል diagnosis ተንተርሶ ሊመጣ የሚችል ችግር ማለት ነው። possible diagnosis a problem may be present but it requires more data correlation to rule out or confirm its existence. maybe exist ምንለው ማለት ነው። possible ምንለው maybe ሊኖር ይችላል ማለት ነው። ለምሳሌ አንድ ሰው ጭንቅላቱን ከተመጣ ምናልባት ክራኒያል ብሊዲንግ ሊኖረው ይችላል ብለን የምናስብ possible ማለት ነው። ለዛ ምንድነው ሲቲ ስካን ምናምን የምንልክበት ሂደት አለ ማለት ነው። ሲንድሮሚክ የምንለው ደግሞ a cluster of problem predicting to be present because of an event or situations. ለምሳሌ እግሩ የተቆረጠ ሰው ከተቆረጠ በኋላ ነገ ሊመጡ የሚችሉ ፕሮብሌሞች ማለት ነው። ሲንድሮሚክ ዲያግኖሲስ ምንለው ማለት ነው። ዌልነስ ዲያግኖሲስ ምንለው a health related problem that requires assistance to perform at a higher level ማለት ነው። እግሩ የተቆረጠ ሰው አለ እግሩ ከተቆረጠ በኋላ ሰው ሆኜ እኖራለሁ ብሎ ቲንክ እንዲያስብ የምንነድበት መንገድ we call that wellness nursing diagnosis ብለን እንጠራዋለን ማለት ነው። ስለዚህ ሳይኮሎጂካሊ ሰፖርት የምናደርግበት ወይ we call that wellness diagnosis. For actual diagnosis there are 3 parts: problem, etiology and sign and symptom of that problem ማለት ነው እዚህ ይኖራሉ ማለት ነው you can read it እንደዚህ ማለት ነው ፎርሙላው እንደዚህ በዚህ መልኩ እንጽፋለን ማለት ነው ፕሮብሌም አለ ኢቲዮሎጂ አለ ሳይን ሲምፕተም አለ እዚህ ማለት ነው ስለዚህ ፎርሙላው ሶስት ፕሮብሌም ኢቲዮሎጂ ሲምፕተም and sign ineffective recurrence example it ineffective recurrence related to incisional pain ምንድነው pain ነው ማለት ነው etiology cause ማለት ነው as manifested by poor cough effect impaired communication related to inability to speak Amharic as manifested by inability to follow instruction in Amharic and verbalization of request in English. This is, you can formulate. Potential when the risk nursing diagnosis a problem maybe happened after actual nursing diagnosis ማለት ነው ስለዚህ ሁለት ፓርቶች አሉት potential problem related to risk factor ማለት ነው ስለዚህ ሪስክ ፋክተሮች አሉ ለምሳሌ ፍራክቸር ካለ there is ምን ሊሆን ይችላል ፕሮብሌሙ ፖቴንሻል ፕሮብሌም ሊሆን ይችላል ብሊዲንግ ሊኖር ይችላል ማለት ነው ብሊዲንግ ሊኖር ይችላል ማለት ነው you can this is an example here impaired skin integrity potential problem ማለት ነው ዲቶሃት ኤጅ ሊሆን ይችላል weight ሊሆን ይችላል immobility ሊሆን ይችላል confident to be ሊሆን ይችላል ወይም ደግሞ bedridden ሊሆን ይችላል ማለት ነው እንግዲህ ፍራክቸር ያለበት ሰው አልጋ ላይ ሊቆይ ይችላል አልጋ ላይ ያለው ምን ሊሆን ይችላል ስኪን ኢንቴግሪቲ ኢምፔርድ ሊሆንበት ይችላል ማለት ነው ያ አያችሁት ሪስክ ፋክተሮቹ ኦልሬዲ ኤግዚስት ናቸው እነዚህ ሪስክ ፋክተሮች ኤግዚስት ካደረጉም ሊሆን ይችላል ፖቴንሻል ፕሮብሌም ዲቨሎፕ ሊያደርግ ይችላል ማለት ነው you can read it the next one is planning it is the third step it is the process of prioritizing nursing diagnosis and collaborative problem ABC method airway circulation and ምናገለ airway breathing and circulation ሶስቱን በመጠቀም prioritize የምናደርግበት ሂደት ነው and it is identified measurable goals and outcomes manageable የሆኑ ጎሎችና አውትካሞችን ምን ማድረግ አይደንቲፋይ ማድረግ helps to select appropriate intervention helps to document the plan of the care planning that is purpose of planning facilitate communication between caregivers direct care and documentation providing a record that can later be used for evaluation and research purpose ማለት ነው steps in planning the first one is setting prioritize establishing goal selecting nursing intervention document the plan of care እነዚህ ናቸው ስቴፖች ማለት ነው መጀመሪያ prioritize 1 2 3 4 ሊሰሩ የሚችሉትን እናደርጋለን ከዛ ሴት ካረገ በኋላ በእነዛ መሰረት እናደርጋለን ጎሎቹ goal 1 expected outcome ማለት ነው 1 2 3 ከዛ selecting nursing intervention ምን እናደርጋለን select እናደርጋለን then interview ካረገ በኋላ plan the document እናደርጋለን መጀመሪያ ምንድነው setting prioritizing ከዛ አየሁት prioritizing ሴት ስናደርግ መጀመሪያ ላይፍ ትሪትኒንግ እናደርጋለን ላይፍ ትሪትኒንግ the first setting prioritizing ላይፍ ትሪትኒንግ ኬዞችን ማኔጅ እናደርጋለን ከዛ ሴፍቲ ኤንድ ሴኩሪቲ ከዛ ላቭ ኤንድ ቢሎንጊንግ ከዛ ሰልፍ ስቲም ከዛ ምንድነው አቺቭ ፐርሰናል ጎልስ በዚህ መልኩ አብርሃም ማስሎውን በመጠቀም እናደርጋለን ማለት ነው ለምሳሌ ኤክሰርሳይዝ አለ which of the following problems should be ይላል A nurse is feeding, a nurse is formulating for a plan of care for a client receiving internal feeding. Which nursing diagnosis of the highest priority? አንደኛው altered nutrition, less than body requirement, high risk for aspiration, high risk for fluid volume deficit, and diarrhea. Which one is highest priority according to nursing process? የትኛው ነው high risk for aspiration? ABC methods እንጠቀም ማለት aspiration aspiration ይሆናል ማለት ነው። እስቲ አንሰሩን ነው እስቲ high risk for aspiration ይት ከዛ establishing goals and expected outcome ማለት ነው። እዛ ይሄን ይት እንግዲህ outcome ጽፎን ነው prevent complication, correct complication, control complication, and it help us to determining specific intervention and evaluating care ማለት ነው። determine ለነዚህ ነው outcome ወይም ደግሞ expected goal መጽፈው ማለት ነው። ስለዚህ እንደዚህ ነው መሆን ያለበት። client centered is high in weight than nursing goal ማለት ነው። nursing goal እንደዚህ ነው መሆን ያለበት ማለት ነው። You are to the example need to high will demonstrate effect airway clearance as evidenced by the ability to clear lungs by coughing every 2 hours ማለት ነው። ይሄኛው more broad ይሆናል ማለት ነው። ጎሉ outcome ደግሞ more specific ይሆናል ማለት ነው። specific ይሆናል compare ስናደርጋቸው ማለት ነው። you can ጎሎችን short term ጎል ሊሆን ይችላል፣ long term ጎል ሊሆን ይችላል ማለት short term በዚህ ላይ ያለው ይዩት፣ long term በዚህ ላይ ያለው ከነ ኤግዛምፕሉ ማለት ነው። እንደዚህ ደግሞ ኦብጀክቲቭ ጎል አውትካም we can use interchangeably መጠቀም እንችላለን። እነዚህ ምንድነው ጎል ኤንድ ኦብጀክቲቭ ሞር ጀነራል ይሆናል፣ አውትካም ኢዝ ሞር ስፔሲፊክ ሊሆን ይችላል። ቅድም እንዳወራን ማለት ነው። ያ follow the rules እንግዲህ derived from nursing diagnosis መሆን አለበት። outcome ስንጽፍ ማለት ነው clear and specific መሆን አለበት። action verb መጠቀም አለበት። criteria set ማድረግ አለበት። specific time መኖር አለበት። smart መሆን አለበት ማለት smart specific measurable attainable reliable and time bounded መሆን አለበት ማለት ነው። አሁን ይሄው ጎል ነው። the client will maintain the expected body weight ይላል። ይሄ ጎል ነው። ገብታችኋል አይደል? ለዚህ ጎል more than 3 expected outcome ማውጣት እንችላለን ማለት ነው። ኤግዛምፕል the first one is አንድ outcome፣ 2 outcome፣ 3 outcome እያለ መሄድ ይችላል ማለት ነው። ኤክሰርሳይዝ እስቲ ኤክሰርሳይዝ በዚህ መሰረት are the following outcome statements correctly written? what is wrong? እንግዲህ outcome ስንል ነው ስፔሲፊክ መሆን አለበት ማለት ነው። ስማርት መሆን አለበት። ስለዚህ outcome ሲባል ስለምንድን ነው? outcome ስንል ምን መሆን አለበት? ስማርት መሆን አለበት፣ ስፔሲፊክ መሆን አለበት፣ measurable መሆን አለበት፣ attainable ወይም ደግሞ achievable መሆን አለበት፣ reliable መሆን አለበት። ምናወጣው outcome ማለት ነው። expected outcome reliable መሆን አለበት፣ time bounded መሆን አለበት ማለት ነው። ስለዚህ የፈርስት ዋን ተስፋዬ will now the 4 basic food groups by 4 January ይላል። measurable so the 4 basic food groups by 4 January measurable ይሁን ግን ስፔሲፊክ አይደለም ማለት 4 ግሩፕ የሚባሉት ነው ማለት ስፔሲፊክ ላይሆን ይችላል ብዬ አስባለሁ። ወይዘሮ ሳባ will demonstrate how to use her walker assisted by Saturday ብቻ worker ብቻ ናት፣ አንድ ስፔሲፊክ ናት። she will demonstrate how to use ነው እንዴት መጠቀም እንዳለባት። አሁን እቺ by Saturday እቺ ልትወጥ ትችላለች፣ ኖርማል ትሆናለች። አቶ ለማ will improve his appetite by 11 appetite measurable አይደለም። ቱሉ will list the equipment needed to change sterile dressing by 9 የትኛው ድሬሲንግ sterile dressing which kind of dressing የሚለው የትኛው ነው የሚለው ለሲዜራ ሴክሽን ለምን የሚለው ይሄ ክሊር ላይ ይችላል። David will walk independently in the hall the day after surgery. It is specific. Specifically. Whether Gannett will understand the importance of maintaining a salt-free, not specific. Whether Tadlich will appreciate the importance of exercise for patients with diabetes, not specific. Atosuyum will feel less pain by Thursday. He specific. Stimmers university. Answers. The first one is not measurable. B is correct. Atolama not specific. Will measure, will improve. Update measure and Gannata not measurable. Atosuyum will feel less pain by Thursday. Less pain below measurable. Lela Wala Gidim establish goal in outcome determining nursing intervention. በዚህ መልኩ ኢንተርቬንሽን ማውጣት እንችላለን ማለት ነው። ማውጣት እንችላለን። ከዛ በኋላ ኢንተርቬንሽን ካወጣን በኋላ ምን እናደርጋለን? ሪከርድ እናደርጋለን ማለት ነው። ሪከርድ እናደርጋለን። ይት ነርሲንግ ዲያግኖሲስ አለ፣ ኤክስፔክትድ አውትካም አለ፣ ነርሲንግ ኢንተርቬንሽን አለ። በዚህ መልኩ ሳለ ማለት ነው። በዚህ መልኩ ሰንጠረዡን ዶት ፎርጌት ሰንጠረዡ አንዩት። እዚህ ላይ ነርሲንግ አሰስመንት ቢቀመጥ አሪፍ ነው ግን እዚህ ላይ ነርሲንግ ዲያግኖሲስ አክቹዋል ፖቴንሻል ዌልነስ ሲንድሮም እያላችሁ ይጻፋል እዚህ ላይ። ከዛ እንግዲህ ኤክስፔክትድ አውትካም ማለት ዛት ሚንስ ኢን ፕላን ማለት ነው። ኢን ፕላን ማለት ነው። ከዛ ነርሲንግ ኢንተርቬንሽን ከዛ ኢቫሉዌሽን ይቀጥላል። ሰንጠረዡ በዚህ መልኩ ታወጣላችሁ ማለት ነው። እነዚህ ኢንክሉድ ያደርጋል። እነዚህ ኢንክሉድ ያደርጋል ማለት ነው። ኢምፕሊሜንቴሽን ኢንክሉድ this performance. Type of intervention: dependent intervention, collaborative or interdependent intervention. Then nursing care evaluation. Regular review of the effect of nursing intervention and the treatment regimen on the patient's health status and expected health outcomes. ስለዚህ እነዚህ ኩዌስችኖች መመለስ መቻል አለበት። ኢንተርቬንሽን እናደርግ ኢቫሉዌት እናደርግ ማለት ነው። እነዚህ ላይ የተደረደሩ ኩዌስችኖችን መመለስ መቻል አለበት። where the goal is realistic, was the patient committed to the goal, was there enough time to achieve the goal, did other problems arise that impeded progress, were intervention consultants performed as prescribed, have any new problems developed that have been addressed መመለስ መቻል አለበት ማለት ነው። ዜን ሜተድ ኦፍ ዜን ዶክመንቴሽን ነው። ዶክመንቴሽን ፕሮብሌም ኦሪየንትድ ሜዲካል ሪከርድ ሳለ እንግዲህ በዚህ መልኩ ማለት ነው። ፕሮብሌም ኦሪየንትድ ሜዲካል ሪከርድ የሚሉት በዚህ መልኩ ፕሮብሌሙ ዲሃሪ ያለ ከዛ እዩት በዚህ መልኩ በሰንጠረዡ በዚህ መልኩ ሪከርድ እናደርጋለን ማለት ነው። ከዛ how to perform ነው። ከዛ በኋላ ፕሮግረስ ኖት አለ። ሶፕ በሚል ሜትድ ሶፕ ኤንድ ፕላስ ሶፒ የሚባል አለ። በዚህ መልኩ ዶክመንት እናደርጋለን ማለት ነው። Okay, thank you very much. That is all I have. This is the reference that I have used during this slide preparation. And thank you for attentively listening. If you have any suggestions, comment, welcome please. That is enough for today. Thank you.